But meanwhile, a White House official has just admitted to reporters on background, meaning the person won't use his name. That person has now admitted to reporters that the Trump policy for the country right now in coronavirus is what's known colloquially as herd immunity, letting the virus run its course through the American population without doing much of anything to try to stop it, under some vague idea that somehow you will simultaneously protect old people and otherwise vulnerable people while you maximize the number of Americans who are infected. This is, I think the technical term is, a whack job, flat earth, totally out there concept in public health. But the White House now admits this is national policy for the United States of America on COVID. In an interview with the Washington Post today about the White House now admitting this is what they're trying to do to the country, NIH Director Francis Collins said this, quote, "What I worry about with this is it's being presented as if it's a major alternative view that's held by large numbers of experts in the scientific community. That is not true. This is a fringe component of epidemiology. This is not mainstream science. It is dangerous. It fits into the political views of certain parts of our confused political establishment." He said, quote, "I'm sure it will be an idea that someone can wrap themselves in as a justification for skipping wearing masks or social distancing and just doing whatever they damn well please." Again, NIH Director Francis Collins. I mean, that appears to be exactly what it is, but apparently the Trump administration is now willing to admit to reporters that this is what the Trump administration is pursuing as national policy. This is what they want for the country. And you can see it in action. You don't necessarily just have to take their word for it, and you never should. They're not only admitting it, they are also showing you what they mean. They're demonstrating this principle at the president's events, at his no masks, everybody packed together events like the one he did last night in Sanford, Florida. He has been holding another one of these very similar events. Look at this, tonight in Pennsylvania. There's another one scheduled that'll be just like this tomorrow in Iowa. The president has started bragging at these no social distancing, no masks events that he's sure he's immune now from getting COVID since he has had it. That's basically what they are promoting now for the country, that everybody should get it. That'll make you as powerful and immune as the president. You should get it. It'll make you immune. This is what the White House is now leading with as their coronavirus message. Well, we now have this new report in a peer-reviewed medical journal that having COVID once doesn't actually necessarily make you immune. COVID-19 reinfection documented in Nevada adds to question on virus immunity. They're medically documenting now people who got it once, recovered, and then got it again, worse. Maybe getting infected with COVID doesn't necessarily render you immune. Also today, a new published report of a woman not only getting COVID a second time after surviving it the first time, but the second time she got it, it killed her. Now that the U.S. government is admitting, though, that this will all be immune, flat earth fringe theory is what they are pursuing for the country, the World Health Organization is trying to raise the alarm as well. The WHO director yesterday convening a press conference to basically hammer it home, saying, quote, "Never in the history of public health has herd immunity been used as a strategy for responding to an outbreak, let alone a pandemic. Letting COVID-19 circulate unchecked means allowing unnecessary infections, suffering, and death." But that's the plan, apparently, and the White House is now admitting it, right? Good luck. 215,000 of us dead already in this country. But, I mean, here's the headlines tonight, as I think the country is starting to wake up to how serious this is and what exactly this means. Here's the headline in the New York Times tonight. White House embraces herd immunity declaration. In the Washington Post, proposal to hasten herd immunity to the coronavirus grabs White House attention, but appalls top scientists. Those headlines running right alongside the breaking news tonight. More than 20 states have set records for new COVID infections in recent days. And antibody treatment trial paused for safety concerns. And second COVID-19 vaccine trial paused over unexplained illness. I mean, you take all this stuff together, And here's the big picture, right? We are 21 days out. We are 3 weeks from Election Day. More than 10 million Americans have already voted. We're in the middle of the election, basically. Our country is rocketing fast into a third big wave of COVID. Dozens of states hitting records, hospitals filling up already in multiple states. There is no vaccine. There is no cure, despite the president pretending that there is a cure and maybe it's him. There is troubling new evidence that getting infected doesn't necessarily make you immune. But the most powerful country on earth is nevertheless now admitting that we are pursuing a radical experimental fringe strategy of trying to get our whole population all infected anyway, because maybe we'll be immune if we do that. Could be. Regardless, they think just everybody purposely getting infected will be easier than wearing masks and the other things you need to do to stop people from spreading this thing. And besides, nothing matters. Who knows? Let's just see what happens.